As a segue, the DPH reports the following metrics for Hopkinton. The data does not include any home testing results. So the DPH reports that we've had 91 cases during the month of February. We're averaging 6 cases a day. That's an improvement over the last 2 weeks of January, where we were averaging 7 to 8 cases per day. Let's see, our 14-day positivity rates at 10.35. Our 14-day incidence per 100,000 is at 71.9. 40% of the cases that we saw this month, or that we've seen this month, have been in children under the age of 19. So, much of what we've seen over the last couple months is the same. It's just we're seeing less of it. So we know we've got an opportunity in the school age kids. Our metrics are getting better. To be responsive, my public health nurses and I, we did reach out to a variety of different sources this week to try to see or assess whether or not we've had any, residents transported. And what we did learn was that 6 senior residents were transported to hospital with respiratory distress from Fairview Estates over the last 2 weeks of January. We've spoken to the residents. They required nebulizer treatments or antibody treatments to mitigate the symptoms they were experiencing. And our understanding is that they've either returned back to Fairview or they have been relocated to other facilities. Other than that, we haven't had really any reported hospitalizations or transportation, over the last 2 weeks. So we're doing better than January again. On February, or actually on the 7th of this month, the Washington School of Medicine in St. Louis released an analysis of federal health data that people who have had COVID-19 are at a 4% increased risk of developing a cardiovascular complication within the first month to a year after infection. We're bringing this up because, as we move towards this concept of personal responsibility, as we're transitioning out of the pandemic to managing the risk of COVID in the home, we want people that have had COVID to have conversations with their primary care physician. We want parents to have conversations with their pediatricians to discuss whether or not the pediatrician feels that their children might be at risk. Because this is where we're going. We're going to be talking to our physicians. I've got the flu. I'm feeling this and this, and we want to establish those, those connections with our physicians, so that, again, as we move out of the pandemic and into this just being another illness that we're managing, we want to have those relationships set in place. As for the ongoing restrictions in the municipal setting, our recommendation to the leadership in EMG is that we remove the restrictions when our cases per 100,000 and percent positivity drop into the CDC's low risk rating. So what does that mean? So for cases per 100,000, that involves our case numerator to be below 10. Right now, we're at 71.9. As for our percent positivity, we want that to be below 5, and we're at 10.35. We are moving in the right direction. I'm hopeful and optimistic that we'll be there at or before the 28th. But we know that these metrics that the DPH are providing, they don't include home tests. So they're actually underreporting or underrepresenting what our risk is.